So my name is Dr. Susan Fox. I'm a doctor of acupuncture and Chinese medicine in the San Francisco Bay Area. And for the past 23 years, my focus has been helping women, people, couples improve their fertility, their fertile health, whether they're trying to conceive naturally or whether they intend to go through advanced reproductive therapies like IVF. And it's been my pleasure and honor to really have that support for these people because it's a rocky road for them, and having someone and something in their corner that actually has actionable outcomes that improve their success is so rewarding. I mean, unlike many backstories, I did not struggle with fertility for myself. However, it was really just one of those right place, right time moments. And that when I started my practice, I happened to open up shop across the hall from an IVF center. And in that year, the research was just beginning to come out how acupuncture was improving IVF outcomes with just a simple procedure done 20 minutes before and 20 minutes after their IVF transfer. And so that began the journey. And of course, over these 23 years, we have learned more about how and why, and that it is not just necessarily this one simple treatment. In fact, we don't use that one simple treatment anymore. We tend to use about at least 9 treatments prior to an IVF retrieval and then another one for an IVF transfer, because it's really about improving the quality of this person's whole health, reproductive health, and therefore the follicles in the eggs that are growing with. Ideally, we would begin about 3 months prior because that is the arc of what we call folliculogenesis. So the eggs that a woman is going to ovulate this month and next month and the following month are already sort of in play. There's this concept called the primordial pool where all of our eggs are resting until such time as they're recruited each month. But what we do today will have an influence on the follicles and then the eggs that are ovulated, as I say, 30, 60, 90 to 120 days. And when you think about that conversely, right, that means that if we're not doing anything beneficial and we're doing things that are harmful, like exposing ourselves to toxins in our everyday products, pesticides in our food products, poor water quality, poor sleep and wake lifestyle, then we're exacerbating a problem for 30, 60, 90, 120 days. That being said, I want to just highlight that any improvement that starts now has a beneficial effect. So if there are listeners who are saying, I don't have 120 days to wait because for some reason, sometimes there really isn't 120 days to wait. Our bodies are magnificent in their ability to detox and heal and restore. And this is not just me saying it, and it's not just ancient Chinese medicine saying it. I just before this call pulled up a study that just released that talked about how improving our health with something as simple as coenzyme Q10 improves the outcomes of someone with what's called diminished ovarian reserve. Oftentimes that is a person of older years, but not necessarily. I think the message that I really want listeners to hear is that, with an IVF cycle, as brilliant and miraculous and wonderful as it is, these doctors can only stimulate eggs, follicles in the condition they are, can only then retrieve them in the condition that they are, can then only produce embryos in the condition that they are. And so that's why oftentimes there needs to be multiple retrieval cycles because of the condition that they are. I know I'm sounding rather redundant, but that's the place where we change quality. And I say that with a bit of a hesitancy because there is no research that proves we change quality. There's just clinical evidence time and time and time again. We'll see improved AMH levels. We'll see improved follicle counts. It just bears the question, if there's not double-blind placebo-controlled studies proving that it doesn't, or that it does, how can you prove to me also that it doesn't make all the difference? And you just ask any human being. We know innately that when we feel better, when we're taking better care of ourselves, all of our tissues are better. That's my passion. That's my mission, is that I don't want for someone to just have a positive pregnancy test or just a decent pregnancy and an okay delivery and postpartum, but oftentimes postpartum can get tricky. My mission, my legacy is that we are at a pivotal point. It is tipping point time to either improve the health of our children and our communities and our larger communities and our whole, governing bodies at large, which then extends to how we treat the planet by making these changes now. Forever chemicals, formaldehydes, parabens, phthalates, we're putting them in on our skin, in our mouth. When we brush our teeth, we're putting triclosan in our mouth, for goodness sake, if we're not careful. So that's where I feel so passionate that we really do need to make this change now. It's our responsibility for the health of our future. Awareness and action. We have, I think, a decent amount of awareness. Not everyone,
Right.
but we also have habits that we don't want to give up, right? And I see it in clinical
Comfort
practice all the time. Someone will come in with autoimmune disorder, and I'll say, "Gosh, I'm sorry to be the bearer of bad news, but for your health, your follicle health, your embryo health, your baby's health, you will want to go gluten-free because we know that it's an inflammatory agent and it will trigger that autoimmune activity, especially when it affects the thyroid." And that person will sit across me and say, "I don't want to have to give up my bread." And I'll say, "Well, there's nobody who's going to make you, but do you want a healthy baby? Because there is a genetic predisposition toward this." So it's we need more information. We have it. It's out there. We just need to go look for it and then take action. We need to vote with our dollars. And ironically, when we vote with our dollars, again, the other argument is it's too expensive to go organic and to get these other products. But in fact, it's not. Or produce has become much more accessible. As in Costco. If you can't find it fresh, that's fine. Get it frozen because frozen is just picked and frozen, so it's about as fresh as can be. So there really are ways in which we can get organic foods without its, kind of breaking the bank. We don't have to go to farmer's market. I mean, that's a lovely experience.
Right.
We can go to, it's some of the bigger name brands. We can impact, some of the other brands, Target and Walmart, and they'll all have, their frozen food section. Just reach for the organic. And when we eat organic or grass-fed, we organic, free range, wild caught. We don't need to eat as much because that's the other side of things, right? We tend to overeat in our society, and part of it, I don't want to create a judgment because part of it is that we're eating but we're malnourished. So there's a part of our bodies that's saying, I need more because I don't have the nourishment. But if we eat properly, then healthfully and drink healthfully water, then we won't be having these cravings and our brain won't be saying, "I need more glucose fast because you just gave me garbage." And, again, in terms of expense, some of it we can just do on our own. We don't need to go buy high level organic products. We can make our own. And there are recipes out there on the internet, our own face wash, our own, shampoos. Personally, I'm a little lazy, so I will buy and I will pay what might seem like a premium dollar, but then my hair is not falling out, or I'm not getting a disease, or I'm not getting a poor microbiome that's leading to receding gums and cavities and mouth ulcers that also affects our whole bodies. Our oral microbiome affects our gut microbiome, vaginal microbiome. We're not separate. These parts of our body are all in communication and relating to each other. As a result of doing this for 23 years, when 2020 arrived and we were not able to see people in person for a while, it dawned on me that not only did I want to reach the people who couldn't come into my physical office, I wanted to reach people who couldn't come into an office. So I designed a course that has all the modules in it. So for instance, you can do your own acupoint stimulation without needles. You can do it with an infrared light. You can do it with a TENS machine. And because, infertility and IVF is a stressful experience, in the course I also included sort of mind-body guided meditations. We've seen in research, again, that it can be as stressful to struggle with infertility as it is to struggle with a cancer diagnosis or some other life-threatening disease. Wow. The data is there to back that up. So I wanted to make sure I added that mind-body component. And then there's a series of qigong, all of which are designed to help a person recognize where in a menstrual cycle she is. And I'm going to use the pronoun she, so forgive me. Um, and then have a mind-body relationship with what's going on right now so that she can influence what's going on right now. So she can include this targeted circulation to her ovaries from the end of her menstrual flow to either ovulation or egg retrieval in a cycle. And it's been so rewarding. It's not about taking my word for it. On my website, there are testimonials from these women who have just been told, forget about it. Go get, you need donor egg. You're too old. And they're conceiving naturally or having, in one case, I'm thinking of, went through IVF unsuccessfully. 2 times this happened. With her first child, unsuccessfully, did the program, was able to get pregnant. 2 years later, fast forward, did IVF without the program, unsuccessfully, came into the program, and then was able to get pregnant again. So it's not rocket science, but it is science. So this is a step by step. Each week of your cycle, it includes, these are the foods that are ideal to eat at this time in your cycle, and this is why. It's through the lens of Chinese medicine. That's my area of background, and I use what's called a 5-element model of Chinese medicine that also includes the emotional component, because we're not all cookie cutter. We're not all the same. If you and I have a problem, we may respond differently, and I may respond with anger and irritability, and you may respond, weepy and crying. And those responses, those emotional responses, will help in the 5-element Chinese medicine model say, this is your 5-element constitution, if you will, your proclivity, and here's how you can help support that. Again, it just empowers us to be able to say, I'm seen, and I can help myself, and I can help others. I'm going to give Western medicine a break and say they're as caught up in the problem as we are, and in that, how can you give all the information in a 7-minute consultation, right? Which is what they're required to make sure that they process all of these patients, and they're not trained. They're not trained in nutrition. They get in their 11 years of training, maybe 20 hours, if that, of nutrition. So that's like asking your mechanic to do cardiac surgery, open heart surgery, right? So we just, we need to support each other. And that's, if I may, again, I'm excited about this thing that I'm doing in that I'm putting together a summit, an immersive series that will air in January. And I brought together IVF docs, reproductive urologists, naturopathic physicians, IVF coaches, acupuncturists, psychiatrists, to show that we are really in our field, arms linked in wanting to support our patients and give them, our clients, whatever we call them, and give them the best care and outcomes. Because I think out there in the world of the internet with searches, it can really feel like we are each at odds with each other. And really, when you're understanding the inner circles, if you will, maybe there are some outliers who want to say, IVF bad, only natural conception good, or vice versa. And those who are in the IVF field saying those people are dangerous because you might be missing your window. And neither is 100% correct, and both have rationale. I really like to see and share that we really do work together on behalf of our patients. I'll be sure to share with you when that drops. And if with your permission, I'll share with you the links to my website. There's actually a quiz that someone can take for their 5-element constitutional type. It's just called yourfertilityquiz.com. And you'll get a report that says, based on your answers, this would be your 5-element fertility type. And here are some ways in which you can help sort of get yourself back into balance. These are ways you might find yourself out of balance. These are ways you can find yourself back into balance. And that's all free. And then if somebody says, I'm really interested in this and I really want to conceive, then the course is there for you. Included in the course includes these devices that I talked about, these infrared machine and TENS unit, because that's another thing. And you probably recall running for all of these appointments when you're trying to have a work life, relationship life. It's crazy making to have to do all of these appointments, so that to be able to just do it when you wake up in the morning or, before you go to bed at night, and know that you really are doing as much, if not more, because you're doing it 6 times a week, not once or twice a week, to really improve your outcomes. I think that that is so helpful and empowering. I wish that there would be more comprehensive centers, because you do need to physically go into the IVF facility, so to be able to really have something like my program be part of the experience when you walk in the door, because you need to get your labs. You may need to get some diagnostic testing. You may need to get some treatment before you go through the actual stem. All of that time you can be using to improve your outcomes. So I wish, I mean, if I ruled the world in terms of IVF, then every center would have this, accessible. Again, you don't have to be physically in the office, because that's more time, but just to know that this is available for you so that you can improve your outcomes. And once again, this is where I get on my soapbox, not just your outcome, but the future. I mean, really, the future of our world is dependent upon how well you improve your whole health and your fertile. And once again, I even challenge the word infertility, because I really think we're struggling with subfertility based upon our lifestyle, based upon toxic load, if I were to just say it in one word. And all of that could be reversed. We could reverse infertility. There'll be people who are going to need IVF, same-sex couples. If somebody's had a diagnosis of cancer and needs to, quickly harvest some eggs or embryos, there will be a place for that. Or if somebody just starts later in life, nature is dictating that later in life, from ages 36, 37 to 43, which is a pretty large contingent of people starting for the first time. Life is just presented that way. They are going to benefit from IVF. They're going to benefit from the insurance policy, if you will, of having embryos in storage for when it's time to, grow their family. And I don't want to share too much of my personal belief system, but just to say in a nutshell, we wouldn't have IVF if the greater intelligence, power, God, whatever you call, didn't say, okay, you little ones, you little humans, we're going to let you figure this out now. It didn't come. It didn't come out of the blue. These any idea that comes into form that then develops into all the way to science, existed. And so I think that IVF is something that we've been given permission to step into, which is why I feel that it is really a blessing for so many. I think that perspective lets me take this boogeyman, image out of it, that there's that there are evil doctors at play and at prey here. And that I just think that's impossible, Frank, whether it's political discourse, public discourse, kitchen table discourse, and that's maybe a silver lining to the dilemma that we're all living through, is that it really has elevated the conversation. And it is kind of a current #MeToo movement where, even in this summit that I had just mentioned, I'm putting together, many of these guest expert speakers revealed that their families were IVF families, or that they had struggled with infertility. And so it's really so beautiful, because I didn't know. I mean, I know these people as professionals, and that they would reveal this as part of their presentation was just so heart-centering and connecting. It makes us all realize we're all in this together. And if I may, I just had a thought, because I think for the topic here, how I ally, one of my other big dream is to have this be also in the awareness of the employee benefits manager, human resources department. We're seeing lots of movement, and it's wonderful, toward providing fertility benefits through the, corporate world. But yet, once again, if you're just paying a claim, then you are still working with this person who is having her IVF experience, back to my beginning, exactly how she is, which is then going to need multiple retrievals, which then becomes a bigger expense. And so if you're listening out there, any employee benefits managers or directors, you could pay for one retrieval cycle versus 3 retrieval cycles, which is to say 30,000 versus about 100,000. And all the time that it takes for that person to be out of the workforce fully, and the emotional toll that this is taking on this person, that employee is going to be like, oh my goodness, it's not just for money. you actually care about me as a human being and my experience, and then that person is going to be more, I'm going to say, in gratitude to the company itself, to the company culture. If you had to go into your human resources department and say, I need to do IVF for whatever reason, and the employee benefits manager or the department itself had this all spelled out, you almost immediately have an experience of, oh, it's going to be okay, as opposed to, oh boy, here we go. We're just going to throw spaghetti at the wall and see what happens. All that anxiety that produces, and it wants to get all that time away from work and productivity. That's what would get me on board if I were the employee benefits manager or the company owner, or the CEO of a big conglomerate. When you're dealing with thousands or tens of thousands of people, you're going to save millions of dollars, and you're going to earn countless, it's just incalculable amount goodwill and trust with your employees.